Niall Dickson is here in the studio, Chief Executive of the NHS Confederation. Morning to you.
Morning.
I mean, for NHS staff, obviously vital that this list came out, and for those who do have to send their children to school, simply the difference between allowing them to work in a hospital or not.
Yes, it was vital, and it was vital too that it wasn't just a situation where, for example, both parents were key workers. If just one of the parents is a key worker, they're entitled to do this, and I think that's absolutely right in the circumstances that we're currently in. The National Health Service, and I should say as well, social care being included, social care often forgotten. I think increasingly in an emergency you see that these are sister services. The one depends on the other, and they are now, I think, really marching in step in a way, perhaps in peacetime as it were, that they weren't. And I think you are seeing some of the best in terms of people being able to flex. I think the other thing, observing how the health service is responding, is that we don't hear enough, frankly, about the pressure that's on community services and on GPs and so forth. Obviously, if we're discharging 30,000 patients from hospital beds and sending them out into the community, you can see the effect that that is going to have. And things like mental health services, again, they're not much talked about, but all these areas are under enormous pressure at the moment, and they're all changing the way that they work and trying to adapt and flex to what is going to happen.
Yeah. With your wider NHS Confederation hat on, as it were, there's a lot of talk in the papers, and in fact we talked to people on this programme, concern about the kit that is available to NHS staff to keep them safe. Is it that we don't have enough of it? It's not in the right places? What's happened?
We do have enough of it, but I think there has been quite a significant hiccup's probably too little a word. There's been a problem over the last few days. I think there is anxiety that clinical staff may lose confidence and think, oh, there isn't the equipment there. There were hospitals that were in a sort of critical condition in terms of accessing the kit.
Has that happened, do you think, that some NHS staff have lost confidence in the way that this is being...
Yes, you can hear that from spokesmen even on the media. I think there are people, and of course everybody is trying to adapt, so not to be overcritical about what happened at the centre. They got absolutely overwhelmed by the number of requests in a very short period of time. The good news is, I am told, that they have now sorted this out. There were emergency supplies being delivered to London hospitals in particular where there were significant problems with that. They've sorted this out. And the other good piece of news is that we do have stockpiles, and quite unusual in that we have a pandemic influenza stockpile as a country. Lots of other countries didn't have that. And we've also got, here's a good byproduct of all the no-deal Brexit preparations, we had additional stockpiles to prepare for. They weren't all redistributed thereafter. So we think at the moment there's enough. The other problem, though, is that these things come from China. There has been obviously concern about would we be able to replenish again. I think the good news is the Chinese have started producing again.
Just a final brief thought, Neil, again on a wider issue. Again and again we look at people, and you look at people particularly in London and in other places as well, sort of carrying on almost as if nothing was happening, going to pubs and restaurants, etc. And then you look at what's happening in France, in Italy, in California. We were hearing overnight about people being told to stay at home. From the perspective of health workers who see this coming, are we doing enough?
Well, I suspect that among some clinicians they'll think we should be doing more, and others will have faith in the modelling. The fact is we do have some of the best scientists anywhere in the world. We do have some of the best modelling, and we have had some opportunity to be a little bit behind some of the other places in the world. So I don't know whether our approach is going to be right in the end, but I think we should have some faith. I think these people, first of all, the politicians are listening to the experts. So this isn't about politicians trying to do one thing and so forth. I think genuinely they're listening, and I think we do have some of the best experts. But of course, experts disagree with each other. There are always slightly different ways of looking at it. But the key message is around the hand hygiene, the social distancing, keeping apart from one another, working from home where you can, and the like. All those things I think are absolutely vital. I'm not sure we'll manage to get over it in 12 weeks, but because the planning assumption is around 24 weeks if we really get everything right. But maybe after 12 weeks we should be at the peak, or perhaps slightly over it. Yeah. But there is a long way to go in this.
Niall Dickson, thank you very much.